Social protection is a fundamental human right. Social protection includes policies and programs designed to alleviate poverty by providing workers with access to medical care and benefits in case of sickness, unemployment, old age, work-related injuries, family responsibilities, maternity, disability, and death. The COVID-19 pandemic brought to light the vulnerabilities in social protection systems worldwide, especially affecting migrant workers. They emerged as one of the most impacted groups due to the lack of protection in times of crisis. The ILO, since its inception, has established standards to ensure social security rights for all workers, emphasizing the principles of equality and non-discrimination. Social Security Convention number 102 sets global minimum standards for all aspects of Social Security, including coverage for migrant workers. It mandates comprehensive and adequate protection benefits with predictable payments for all. Internationally, migrant workers make up an average of 4% of the workforce. In the Arab region, this figure significantly exceeds the global average, with the highest percentage of migrant workers in the workforce standing at 40%. Out of some 169 million global migrant workers, over 24 million work in Arab states. Gulf Cooperation Council (GCC) countries host around 3/4 of them. They primarily hail from Asia, with notable numbers from other Arab nations and an increasing presence from Africa. They are mostly employed in the private sector. Lack of social protection amongst migrant workers not only affects the well-being of migrant workers, but also creates social and economic vulnerabilities for their families and communities in their home countries. A new body of evidence produced by the ILO, pioneering in its approach, has mapped the social protection situation for migrant workers in the GCC countries. The research revealed significant gaps. These have been attributed to several factors. The kafala sponsorship system, which ties a worker's residence and employment status to a single employer. The short-term migration paradigm. The employer bearing the sole responsibility for the worker's social protection coverage instead of having an institutional framework in place. The employer-centric nature of this arrangement, making monitoring and enforcement difficult, and leading to challenges when addressing grievances. For instance, research shows that 4 in 10 Nepali workers did not receive indemnities at the end of their contract. Still, things are gradually changing. New avenues are emerging across the GCC to extend social protection to migrant workers, both in legislation and practice. Changes include expanding short-term social insurance benefits to migrant workers, as in case of maternity, sickness, and unemployment. Reforming end-of-service benefits by creating national provident funds. Shifting towards mandating social protection coverage through a private insurance, especially in relation to health insurance. To capitalize on these developments and address the remaining substantial gaps in implementing social protection rights in the region, a few actions are pivotal. Ratifying and implementing key ILO conventions related to social protection. Transitioning towards a social insurance model recognized by international standards as the most effective means of providing comprehensive social security protection for all. Sustaining ongoing efforts to move away from the kafala sponsorship system. Increasing focus on improving effective access to benefits. Increasing collaboration and improved coordination between the destination and origin countries. Strengthening tripartite social dialogue among state actors, employers, and workers across the migration corridor. Ensuring that the voices and needs of migrant workers are heard. Check our publications for in-depth information on the topic.